Good morning, everybody. It's a long opening session, so I'll try not to take too much of your time. My name is Dineke Zeegers. As Iveta says, I work for the European Public Health Associations. We have 47 countries in our network, 22 theme-specific sections, and they're on all topics. It could be public health genomics, it could be forecasting, it could be on public health and law. So we're very widely organized. Since 2007, we're very much involved in chronic diseases, and we have an average of 3 workshops on chronic diseases at every European Public Health Conference. In Marseille, we're even going to have 5 workshops on the topic. Thank you, Iveta. And 2 are on the Scirocco project, which you'll hear much more about during the conference. So my big question is, thank you, Iveta. My big question is, chronic illness and care is all about what we're going to talk about at this conference. It's also about patient empowerment and patient-centered care. So you are the experts here in chronic care. My thought was, what can I bring to you? So my idea is to give you some advice from a patient. This is who I was 5 years ago. I would love to be exactly the same person again, but I'm not totally there yet. And this is what you become when you're diagnosed with a chronic disease. It's a complete change of who you are as a person. So from complete a multitasker, businesswoman, and all of that, you go to being a patient. And your whole life changes. Your whole life changes that the only thing you can think about is the illness. What is going to happen next? What is the treatment? What can we do? It is also that you feel very dependent on others, not just the medical doctors, but also on your surroundings. How is your work going to react? What is your family going to do? So there's a lot of things going through your mind at that time. It is also a family journey, not journal. So there's a lot of things, you're focusing on the patient, but you should focus on the family, you should focus on the friends, you should focus on the network around it as well. So the empowered patient is one, there's internet. You know, if you're a bit literate in internet and you know a bit about health like me, you can actually look up a lot of things. And say, oh, you know, this might be interesting, I'll probably have this is the treatment they're going to do. And then you have to talk to your specialist, and it turns out that the internet is not just all right evidence and could include fake news. Trump just cured cancer, so that's great. Thank you very much, Mr. Trump. Wonderful. But it's also about language. If a specialist talks to you and starts using difficult terms, you're lost. You have no idea what they're talking about. And you're sitting there like, yes, okay, what does it mean? And it's also about time. If you go to your specialist, he will look at you and basically look at his watch. I've got about 5 minutes to inform this patient about what the patient has, what needs to be done, is there any medication, is there any diet to follow or something else. So it's really about time as well. Patient-centered care, in my ideal idea, it would be like this. You have a doctor coming to your bed, he has all the time for you, he treats you like a partner. So you're talking to each other, you see both are smiling, wonderful. But reality is this. You don't see one specialist, you see 10 of them, and they don't talk to each other. So you go to patient number 1, and this is happening. You go to specialist number 2, and a totally different story. So it's very difficult to get grips on who's treating you and what is the treatment like. So what I did when I was a patient, in order to avoid being seen as patient number 23, I decided with every specialist, I would sit down and say, listen, first you listen to my story. I have a career, I have a family, I want to keep living, I want to do this. So that was really my idea of convincing the specialist. Now, patient-centered care is also that they come to your bedside, usually with a group, students as well as other specialists, And you're like, okay, now they're going to tell me something. No, they don't tell you something, they talk to each other in difficult language on top of it. So you're like, you don't know. They leave the bedside and you're like, looking at the nurse, what's going on? So you want to know the truth. And there's also patient privacy. Now, even in the Netherlands, nobody has a private room unless you can really afford that. So you're on a ward. So other patients can hear what's going on with you. Now, in itself, they have their own problems, but some of them then come up to you and say, oh, you got this and this. Oh, well, I had a sister who had it as well. You don't want that. And even when there's friends or relatives visiting you, there might be a doctor saying, oh, you know, what about this and this? And you don't want everybody to know that. So that is patient privacy. You should rethink patient privacy and probably not give information on a ward. So then I come to access to medicines. Well, access to medicines in the Netherlands, where I'm being treated, is wonderful. You know, you got all the medications, not a problem. But you get prescriptions by your general practitioner, by specialist number 1, specialist number 2, specialist number 3, 4, keep on going. And you get a list of medication. You have no idea, do they work together? Can I take them all in the morning or should I take them in the evening? So then you go to the pharmacist, and basically the pharmacist should take the time to sit you down and say, listen, you're getting these medications, watch out with what you eat with that, no wine, usually, no wine with the medication, unfortunately. And every time you have a change in medication, you have to go through the whole process again. So it's very unclear, and it's very, it's not very satisfying for a patient to go through this process all again. Now, I like to travel. I'm here today. I like to travel throughout Europe and do my job. But it's very difficult if you have a medication and you want to travel abroad. So I found out a couple of months ago, I've been traveling with medication for 4 years now. I found out a couple of months ago that actually there's regulations if you go abroad. It's not advertised anywhere. The pharmacist won't tell you. You have to find out by yourself. So you need your certificate from the doctor. You need a certificate and a list of medication. And then, depending on where you go, is it the Schengen country, non-Schengen country, non-EU country, it's again different regulations. So it's very strange. And I found out that you need to have a certificate signed by a judge nowadays, at least in the Netherlands. And normally, they do it for how long are you going abroad and to which country? So I said, well, I'm going to France and Switzerland, I'm going to Slovakia, I'm going to Poland next week. And they say, well, no, it's one country. For every country, you have to have your special certificate, which is impossible. If I want to do my job, it's just not possible. So finally, I managed to find out that there is an exception to the rule. And that was even more difficult. So now I'm just traveling with my medication. I have a list of the medication I'm taking, but I don't have the official document. So I hope nobody stops me at the border. And if they do, fortunately, every country I go to, I know very well public health people and doctors. So if it goes wrong, I probably always get my medication anyways. So some final advice from me, a chronic patient, to you, the expert. Make sure that you include the family. It's very, very important. Treat the person as a whole person, not just a sick individual. There's so much more to a patient than what you see in a bed. Take your time, take the time that is needed. But also, my advice is nurture your health workforce. They have to have the proper training, they have to be accessible, and they have to be appreciated. My biggest friends in hospital were the nurses. They were wonderful. They did all the extra things. They would check things for me, come in the night and sit next to me if I couldn't sleep. They were wonderful. They're not very much appreciated. So that is something which is also I want to give to you. And finally, of course, enjoy this wonderful conference. Thank you very much.